So today we're going to talk about a common injury that's associated with fall sports. We're going to talk about medial tibial stress syndrome, also known as shin splints. Shin splints are commonly categorized as pain located along the front portion of your shin bone. It's often associated with repetitive force and excessive force placed on the tibia or front of your shin bone, as with running or prolonged standing, jumping, anything like that. Some common symptoms associated with shin splints involve pain located along the shin, which can be dull, sharp, achy, pretty much anything that's any type of discomfort. You can have increased swelling along the area. You can have point tenderness, which can be anywhere from the top to the bottom or anywhere in the middle. Another symptom of shin splints could also be increased pressure in the lower leg. If these symptoms are not corrected appropriately or effectively, you could also lead to stress fractures in the tibia or compartment syndrome. Compartment syndrome is a much more severe case of shin splints that can actually limit you or completely take you away from your sport or activity. How do you know if you have shin splints or if you're on the verge of getting shin splints? So a common thing that you'll notice is increased pain with any type of activity. It doesn't necessarily have to be a ton of running or a ton of walking, but if you notice that you're starting to get some discomfort with some excessive walking, that may be a sign. Also look for pain along the shin. If you're just kind of palpating, which is just pushing on an area, and you notice some pretty sensitive areas, that may also be a concern. Also think about if you're just standing and you just go up to jump. If you have pain and it kind of comes through your heel and up your shin bone, maybe that may be another source of pain. Let's talk about a cross-country runner. When you're running cross-country, you run on different levels of surface. You have grass, gravel, and maybe a rocky terrain. Each level of terrain is going to have a different impact on the shin bone. So based upon where you're running, you should look at the support that's placed inside of your shoes. The structure of your foot plays a very big part in how you react to the shin splints. So for a lot of people who run, their feet may curve in or out. So let's just discuss pronation of the foot. Pronation of the foot is when your feet are turned in, so you basically have no arches. With that being said, if your arches fall flat, your knees cave in. When your knees cave in, your hips are weak. So if we can take that chain and reverse it the other way, strengthen the hips, which then shifts the knees back to where they should be, which are directly under the hips, it takes the pressure off the inside of the foot, which also takes the pressure off of the tibia, which creates less impact when you're running. With that being said, here at Lounge Sports Therapy Center, we don't solely look at the location of the pain in your shin splints. We'll also look at the build of your kinetic chain from the lower body up. So based on your ankles, where do they fall? Then we'll move up to the knees. How do your knees set when just standing, walking, or basically doing a squat? Then we'll look up towards your hips, checking flexibility, strength, or anything that seems to look off from where it should be. Initially, we'll start with trying to decrease the pain and swelling associated with the injury. Once that's taken care of, we'll then move on to proper stretches to get through the mechanics, and we'll also look at secondary factors that can contribute to the shin splints. Some common secondary factors associated with shin splints are gait mechanics, improper shoes, and excessive running. If you have or think you may have shin splints, go ahead and give us a call or click the link below so that we can get you back into your sport safely and effectively, but as soon as possible.